In any case, I want to start with a question that came in on the CARD Facebook site earlier last week that we promised that we would take it as the first question. So a mom wrote in and said, my child is 14, has epilepsy, ODD, SPD, and has a mild form of autism, but is very verbal and has started acting out at school. How do you decide what's bothering him? Help, we are all at our wits' end. Now, I will say that I believe that I asked that we reach back out and ask for more information, and I haven't gotten more information. One of the things I specifically asked was for them to, before we brought you in, that if we could know, has anything changed? But we haven't heard anything back.
Right, but I mean, this is the perfect example of when you need to do a functional assessment, and this is really what has to happen now. Like, so that would be someone who's trained in behavior analysis would actually observe the individual in the school environment as well as other environments and would see specifically what triggers those behaviors that we're concerned about, the aggression or whatever it is. And until we have figured that out, there's really nothing we can do, because we can make assumptions that something or another is triggering the behavior, but the assumptions are not always correct. And it's very important to just observe and identify what exactly happens before and after the behavior. And what happens before, obviously, we're looking at, antecedents that might cause the individual, like things like a demand being placed or an activity change where the individual doesn't want to change activities, or a variety of things. And on the consequence side, of course, we also have to see what they achieve with this behavior. Are they able to escape a particular thing? Are they able to avoid something for a period of time? Are they gaining attention? What is going on? And unless we know those things, we can't really know how to intervene appropriately.
I always use the example, because somebody gave it to me, of when something's up with our car. If something's up with your car and you go to the registered mechanic, you don't just decide to start ripping things out yourself and rearranging things. And you go to the registered mechanic, and the mechanic you don't drive in and the mechanic goes, okay, without looking at your car, I'm going to replace your brakes.
Right.
We would never do that, because it would be unsafe and it wouldn't be effective. It wouldn't be efficient. It would cost us way too much money and way too much time. The mechanic has to get under there, look at the hood, they drive it around a little bit, they do a battery of different tests. They do an assessment to see what's happening before they attempt to fix anything. They don't just jump in and assume. And if we would be that way about our cars, we should at least be that caring about our kids.
I mean, there's no way, and the traditional many years ago concept of when a child aggresses or tantrums or has anything that we consider to be challenging behavior, the traditional way of thinking about it, the old way of thinking about it is just, it's not an okay behavior, so punish it.
Yes.
And that's not really the way ABA focuses on things. It's more about it's understanding that challenging behavior is communication. And then asking yourself, what is this individual trying to communicate to me? And that, I think, is the key to figuring out how to fix the problem. Because once you identify what the individual is trying to communicate, then you give them more functional ways of communicating that, and then they learn.
I'm so glad that you brought that up, because we had a little discussion yesterday and there was a question about that in particular.
I think I saw the question. I just read something about that.
Yes, because there is a lovely young woman who is making videos on the internet, and it's called Ask an Autistic. And she is an adult who's on the autism spectrum, and she's made some lovely videos. And she had one that was put up over the weekend, Ask an Autistic, what is ABA?
Oh, okay.
And she gave a pretty textbook definition that includes the word punishment in it, because that is part of the definition of ABA. But then she went on to talk about, from her perspective as a person with autism, why no one should ever do ABA with their child, because they punish a child for doing a behavior that is meaningful to them. I'm really scrunching it all together, but that was the main thesis.
Sure.
And I took exception to that and said that is not actually what good quality ABA does.
Right.
It's kind of quite the opposite. And you just brought up punishment. And somebody had written in and said, that I am somebody that my explanation about punishment they felt needed to be cleaned up a little bit by an expert. What they said was, I just watched the episode from yesterday with the jargon. You mentioned that punishment is not effective. I talked about the fact that in ABA, it's very rare that we use punishment in the way that we all think of punishment. Because it's not as effective. They said they think it's important to clarify the difference between the way punishment is used by mainstream and the way ABA uses the term punishment. It isn't bad in the way ABA uses the term. It reduces a behavior. Extinction is punishment and not necessarily a bad thing. I think it's important to remove the negative connotation. As an autism mom talking to parents new to ABA, I find that they are put off by the term because it is used incorrectly. So can you help to clean up
Sure.
my talking about punishment?
Yeah, of course, absolutely. And there's a lot of things I want to say about punishment. First of all, punishment, when used appropriately, can be extremely effective. Years and years ago, the primary application of punishment, which is kind of an interesting thing, was, when you look at it, this is, I would say, I reviewed this when I was early on in my career. So this would have been like in the 80s, early 80s. I reviewed a task force had been brought together who was looking at the use of punishment, very severe punishment, which is electroconvulsive shock.
Like the Judge Rottenberg.
Well, no, that's a little bit different. This was just administration of shock for immediate shock, not, they had all sorts of helmets and things that was very different. We're talking about administration of a short burst of shock for self-injurious behavior. In other words, if an individual was injuring themselves through self-injurious behavior, would shock work to stop that behavior? And it was tremendously effective. It was instantly effective, and it would last for very long periods of time. So in other words, the individual that was a very clear application of punishment. The reason that we don't use punishment in ABA, I guess, is twofold. One is that it's unethical because there are other less invasive procedures that can be used that are just as effective. They may take a little bit longer, or you may have to do more intervention in order for it to be effective. But so that's one reason. One is that you always want to do things that are less invasive so that you can actually do, it's a milder form of therapy to not use punishment. And the second reason is that when you use punishment, you're reducing a behavior without really realizing why that behavior came into existence, and so that behavior will reoccur in other forms. The topography of the behavior will be different. So let's say if someone hit and you punish the hitting, if the person's needs are not met, if the reason they were hitting, let's assume they were hitting because you grabbed something from them. Well, guess what? The next time you grab something from them, they may not hit, but they'll push you or bite or do something else because we're still not dealing with what they're trying to communicate. So that's the main thing about punishment. Now, extinction is not punishment. It could be perceived as punishment by an individual. Anything that is not, does not provide any kind of reinforcement and therefore, doesn't allow access to, I suppose, reinforcers could be considered punishing. But extinction is just removal of reinforcer for one particular behavior. So, during the time that one behavior is on extinction, you could be getting reinforcers for other behaviors. So it's not a punishing environment at all during that time. So, but having said that, extinction is, of course, very effective. Punishment, there is an aspect, I think what this individual is asking about is that there is a misunderstanding where people think that ABA is based on punishment, and it's not. ABA is based on, very clearly, let's talk about this for a minute. ABA is really just the manipulation of antecedents and consequences to a behavior. So it's the giving and taking away of reinforcers. Now, if you do a good behavior and I reinforce it, obviously that behavior will increase in time. If you do a bad behavior and I remove a reinforcer, then that behavior will hopefully go down in time. Now, the concept is basically that by changing these consequences and antecedents around that behavior. I've changed your behavior. Now, your perception of your world could be, you could feel like, oh, they just punished me because they took a reinforcer away.
Right.
You could completely feel that. That's perfectly fine. But the world and the fact that sometimes people think that people are going around and hitting children or something like that is just not true.
Right.
It used to be true, which is why there might be this misunderstanding. Let's be very clear. The genesis of ABA, the beginning of ABA, behavior modification, which would be in the early 60s, did involve punishment, did involve very severe forms of punishment. And as the field has evolved over the past 50 years, there is no need for punishment. And we have come to discover that we do not need to use punishment, where we can use all positive procedures in order to change behavior.
All right.
I hope that helps.
I hope that helps too. While I love our self-advocates, our adults who are on the spectrum who are doing so well that they can speak out for themselves and they can speak out for the community, and I have so much respect for them. It's where I want my son to be like them, and I want them to be heard, and I want them to have their voices. But it also fills me with fear that sometimes the things that they talk about are not up to date and are not entirely accurate for the kind of ABA that you're doing with our kids now. And it anyway, you wanted an opportunity to address this.
Yes, absolutely. I mean, there's several different concepts. One is, what is ABA doing these days? And clearly ABA these days is a very functional ABA. It looks at the function of behavior, the cause of behavior, and it's not about just punishing a particular symptom. That's really not the case. So that is very important to be said. But I think even more importantly is the concept of why would we want to moderate or modify someone's behavior to begin with? And I think that goes to the root cause of this. And I'll present two concepts for the audience to think about. One is, there is such a thing called the legal system. We may not agree with the legal system, but it is a series of rules by which if you break those rules, you are punished. In society, they are the rules that maintain a safe society, supposedly, okay? And we all live with these. For instance, you can't go around hitting people. Let's just look at that as an example. If you hit someone just at random because you're having a bad day or because you're frustrated, you will be punished, and most likely you'll be thrown in jail. So that's that. Now, do we want our kids to understand those rules? Do we want our kids to adhere to those rules? Yes, we do. We have to. We teach our kids, all kids, in fact, we teach them to adhere to certain rules. If we didn't, realistically, it would be a wild society, right? And it would be not safe for anyone. So if there's a behavior that a child or an adult performs or produces, any kind of behavior, if it is in any way going to break a rule or a law of society, we then need to make sure that we are teaching our children not to do those behaviors. Some of those behaviors could be symptoms of a disorder. It doesn't really matter. An example of it is an individual who drinks and drives. Drinking to the point of not being able to drive is a symptom of alcoholism. Do we punish the person? Of course we do, because what they've done is very dangerous. If we didn't punish the person, then everybody out there would just be drinking and doing whatever. And again, it would lead to an unsafe society. So that is a very important distinction that we need to be aware of, is that if an individual's behavior has the potential to produce harm to society, we need to be able to intervene, regardless of whether or not someone thinks it's their right to do this. This has nothing to do with the individual's right. It has to do with society's right to safety and so on. Now, one may argue that certain behaviors having to do within the symptoms of autism have nothing at all to do with society. For instance, an individual may just hand flap, or an individual may just decide to not attend to something, or may speak jargon as self-stimulatory behavior and so on. And perhaps they do it in a way that it is not interfering with others in any way. Okay. Then I think, like anything else, it becomes the parent's job and responsibility to decide for their child whether they want to allow the child to remain isolated in their own behaviors, or whether they want to help the child join the rest of the people around him or her. That's really where it comes in, because we know as a fact that all of the behaviors that one exhibits in ASD are preventing the individual from interacting with the typical world. Do we want this individual to continue doing what he's doing, or do we want them to interact with the typical world? That's really a question for each parent to answer. Of course, I, as a parent, if I knew that my child had the capability to learn to communicate appropriately, I'd want to make sure they communicate appropriately rather than doing the symptoms of autism. Let's not forget, anything that is considered a disorder, it's not anything that is in the diagnostic manual and is listed as a disorder, means that it is severe enough that it is preventing the individual from functioning normally at home or in their job. Do we want our children to continue to function abnormally at home or in their work or school environment? Then that's something that a parent, of course, has to decide. And then, once the individual reaches a certain age, they can decide for themselves. But that's all ABA is. ABA is a series of techniques that help the individual overcome obstacles so that they can join normal society. Whether or not someone wants to join normal society, I suppose, is the decision of every parent.
Yeah. Thank you for all that clarity. I'm going to move on to a question that I promised yesterday that I would get to with you today. Hello, and thank you so much for your show. I've just recently started watching, and I've learned so much already about how I can help my son. My question has to do with sensory seeking. For a few months now, my son, who is 3.5 years old, has started licking his hands and wiping his face with his saliva. He sometimes even just plays with his spit on his hands. I remind him every single time that the behavior is yucky and ask him to stop. But when he does stop, it's not for very long. The wiping his face with his saliva seems to be turning into a compulsion now, and it's worrying me even more. How can I approach this issue? And thank you so much for your time.
Sure. So again, in this scenario, we have to find out what the function of the behavior is. So, and this is a difficult one because it actually involves two sensory feelings, or two senses. And one is the spitting out of saliva, and the other one is rubbing it on his face. So it's very important for us to find out if what he is enjoying, or the thing that is giving him the sensory relief, is that actually spitting out saliva onto his hand, or is it the sensation of something wet on his face? And it is not necessarily both of those things. In fact, it's probably one or the other. So you kind of need to figure that out. And I guess the way that you do that is that he licks his hands and then he wipes it. So the question I have is, if you were to prevent him from wiping his face, would he still lick his hands? Or is it really, or let's put it this way, if you gave him, something wet, would he then use that to wipe his face? That would be the appropriate replacement in my mind. What you have to do with something like this is identify which sense. Is it the wetness on the hand, or is it the wetness on the face that he's seeking? Whichever one it is, you need to give him something that's more appropriate to produce that sensation. Hands, very easy. You can give him a wet wipe, or like one of those little things that you open to wash your hands. Right. Or even a dry soap, or whatever, the antibacterial soap. Right. Depends if that's the sensation he's looking for, or if he's looking for wetness on his face, then perhaps you can on a regular basis have him just go and splash some water on his face. You will need to replace it with something that produces that sensation for him, and you have to block it. When it's about to occur, you need to block it and replace it. But before you do that, you're going to have to figure out why he's doing it. Which sensation is it that he's needing more of?
Okay. Wonderful. Dear ladies, my daughter needs to start wearing a bra. She doesn't like anything tight-fitting. She's nonverbal and typically uses behavior to communicate, and frequently lifts her shirt up at school as a form of escape, as reported by the teachers. We tried undershirts. She lifts them up as well. How can we get her to wear a bra? And thank you.
So this you should do in a shaping process here, and so what you would want to do is you'd want to buy one of those, and this depends on your. Do we have the age? No. So, and I don't know if you're okay. So, there's a few things I don't know. I was going to suggest that you should buy one of those undergarment things that are full body, that like dancers wear.
Yeah,
you know, that
bodysuit.
bodysuit type thing, right? Which a lot of them now have inside them a loose-fitting bra.
Yeah.
There's two concepts here. One concept is that you need to start with a very, very loose-fitting bra that's very comfortable. And what you should do, let's just put the undergarment away for a second. Let's just talk about the bra. So basically, you will find a bra that's, let's say, 4 inches larger than, or you can get a bra extension.
Yeah.
Which are the clips that you put on the back, and it makes it wider so that it's a very loose fitting. And you should start this probably on a weekend day when she's with you, so that you put this on and you time it literally for, I don't know, whatever the maximum is that she's able to keep it on, let's say 5 minutes. And you set a timer, and then at 5 minutes you take it off and you reward her. First you reward her, and then you allow her to take it off for a period of time. Okay. And you do this throughout the course of the day, and throughout the course of the day you increase the duration of time that she's wearing the bra. So let's say by the end of the day you want her to be able to keep it on for 2 hours. Okay, or maybe an hour, it depends. If you have 2 days, it's better to stretch this out. So now you're at a point where she can keep the bra on for certain periods of time successfully, and that's great. Now what you're moving on to is making the bra a little bit tighter. So go to actual size. So basically now, after a week of keeping the bra on at a certain interval, and you get it to a point where it's feasible. You increase the duration of time so that it actually ends up being, let's say, all the hours that she's in school, so that she doesn't have to take it off during school. And then you just get it down to size. That's another shaping schedule that you add on top of that. So you gradually tighten it. Now, the bigger concern here is that she starts to lift up her shirt at school. That's a completely different behavior. We're not sure if she lifts up her shirt because there's something tight on, or just because it has become a behavior that maybe she gets attention from it, maybe she likes the coolness, I'm not sure.
The teachers say it's to escape something.
Right, okay. Well, that's important. If she's trying, so she does that in order to avoid doing some other thing that has been told to her. So then this behavior essentially of pulling her shirt up has to be extinguished, which really can only be done at home, which means when she does that, you just ignore it and you continue doing what it is you're doing. Now, the best way when there's these things that you have to ignore, what happens is, obviously during extinction, something gets worse before it gets better. So we don't want her to, in school, be walking around pulling her shirt up all the time because we're ignoring it, and she's on an extinction burst, so she's kind of like doing more of it to get your attention. So again, best thing is to have something that she can't lift, which is where I was talking about the bodysuit.
Yeah.
So the concept would be that you'd have a bodysuit on, let's say, over the loose bra, so that she really can't pull her shirt up. There's nothing to pull up. Or she can pull her t-shirt up, we don't care.
Right.
There's a bodysuit that's protecting her and not showing anything. The other thing you might want to add is just give her something in her hands a lot of the time. This will help her just to, you're inhibiting the motion of pulling a shirt up if her hands are busy. So these could be a variety of different things. She could be carrying a purse. She could be writing. She could be holding a journal. Various things that occupy your hands. That way, it's less like this will extinguish easier because she'll be distracted.
I just thought of the word leotard. That's what you want to look up online.
You want to look up leotard, absolutely, or even just underwear, lingerie that has like a clip down below.
Yeah, like a teddy. That's isn't that what they call the full? I don't know. Onesie,
yeah, maybe
whatever
it's called a teddy. Yeah.
I need to look up my lingerie terms. Okay, great. And then write back and let us know how it goes, because I'm sure that you won't be the only person that goes through this, correct?
Mm-hmm.
Now, I wanted to go to a question that we had that came in at the end last week from India.
Sure.
Hello, Mrs. Shannon and Dr. Doreen. This is from India. Thank you for everything you do. I have a child with PDD-NOS, 6 years old, and I'm using skills, and she's doing very well. She's hyperlexic. She is good when it comes to academic curriculum and picking language and cognition. Her biggest lag is social. At this point, I want to know, what are the social and emotional skills that are indicators that are seen in the child who recovers?
Right, so that's a really good question, and I would have to say, I think what you see primarily and what's important is a desire to interact. The mode of interaction may be inappropriate or may not really be what it is, but like what we expect, like the person might be standing too close or, pulling someone's hair in order to get their attention. So the type of behavior might be wrong, but the desire, like you see in some children, that they really want to interact with other kids. They just don't know how to. And I think that desire to interact with others is a positive thing. I think oddly, the desire to please someone is a very, very key factor. It's very interesting that is a very key factor in pretty much all the child's success with ABA. It's just the desire to please the parent, because most of the reason typical children behave well is because they want to please the parent. And a lot of times our kids are so, they're reinforcers. What's meaningful to them is so different that they don't really care to please the parent, and that's when we have problems. So social behavior, I think that one of the precursors is just being interested in others. And then the second one is like wanting to please others. Those two together generally lead to good social behavior in the future. Emotional behavior, one of the old things about autism in the years and years ago, like maybe Diagnostic Manual 3 or something, used to say that kids with autism are kind of cold or not able to attach emotionally, and that may have been true back then, but it isn't now. It's definitely not one of the symptom criteria anymore, and I think that all of our kids have, again, some kids are just more independent because they have found something that they enjoy doing and it doesn't involve others. And I think that's probably, as I'm speaking, I think that's probably the key to it. If you have a child who is hyperlexic, for instance, and so they have the ability to entertain themselves with a lot of other things in the world, like with reading or, on the computer and so on and so forth, they're less likely to need social approval because they're getting a lot of reinforcements from their environment. And our environment, our society is becoming a much more lexic society, right? We communicate through writing rather than speaking. So therefore, social behavior is changing as well. But what I was going to say is that if she gets a lot of her reinforcers from reading and books and letters and stuff like that, then you should expect to see less desire or need for human contact, or let's say social reinforcers. Okay, so that's not, but having said that, it's not something to be afraid of, because society as a whole is changing, and our kids, the way they socialize, typically developing kids, is becoming so much more a non-face-to-face, non-social form of communicating with each other. I mean, it's completely different from how we used to communicate.
Yeah.
You know, we would talk to each other on the phone. We would physically go and visit each other because sometimes you didn't even have a phone, right? We didn't have cell phones.
And before that, you used to write letters.
And before that, you used to write letters, absolutely. Yeah. And now it's just the definition of social behavior has changed so incredibly. You know, the primary mode of social behavior is on your iPhone, on your phone, texting each other, and or now even on various games where you chat with each other below the game, which is kind of amazing to me.
It's amazing.
So, you know, for this parent and for any parent who's worried about their child fitting in socially, it's good news because the world is changing in a way, and I've said this many times, the world is changing in a way that I think our kids with ASD will fit in better than they would before because things like eye contact aren't even a requirement anymore.
Right. We're morphing and we're shifting, and it's one of the ways in which we're morphing and shifting that fits with how our society is morphing and shifting because we have more people who are on the spectrum. So,
I mean, if you had a child even 10 years ago who had some sort of object that they were clicking on all day long, it would appear very weird.
Right.
Whereas now, if you don't do that, it appears strange, right? You go to any setting and you look at 100 people in a restaurant, they're all doing that.
It's crazy. So, I wanted to go to a question about biting fingers. Hi, Shannon and Dr. Doreen. My 9th grader still bites his fingers. At home, we can monitor, and he knows about the germs and inappropriateness. How can we teach him to monitor himself at school or when he's on his own? I hesitate to ask the school as I'm sure he doesn't want attention directed to him. Learning from all your advice, and thank you so much.
So, you know, first of all, I think if you know for sure that he doesn't want attention directed to him, and then that's a good aversive to use. So you should probably tell him, first of all, that if he is going to be biting his fingers, you're going to have to tell the teacher. And then the teacher will call him out on it, which is probably embarrassing to him. And embarrassment is always a very good sign. And so then he'll be more likely to remember to stop it. Another thing is they have these things out in all pharmacies and for children who bite their nails, and I think it's called No Bite. And it's harmless and it's bitter, so you might want to put a little bit of that on his fingers. And everybody uses those for kids, just any child who's biting their nails. So that might be something else to do as well.
Okay. Wonderful. I love one mom once said, because we have such a hard time as parents understanding about extinction and what to do when, and I love that one parent said that they had made it easy for themselves, and they said, whatever it is that he wants when he's doing that behavior, I give him the opposite. So if what he wanted was to not get attention, I give him attention. If he wanted attention, I give him the opposite.
That's exactly
right. And I went, I want to put that on my refrigerator.
That's so smart. That's exactly right.
Kelby, we have a programming note from one of our dear viewers who says that when we're playing the clips in between, that they are significantly louder and they're having to turn down and then turn back up. So just to let you know. I would have waited to tell you during a break, but then it would have been loud again. So Kelby says thank you. The person has just written in and said, Dear Dr. Doreen and Shannon, how can I improve my 6-year-old's emotional control? He has high functioning autism. Is there something we can do daily? He cries easily and has terrible tantrums. And then sometimes he seems to really enjoy running around, hitting his brother and not listening to me. He can switch on a dime. 1 second he's sweet, and the next his behavior is out of control. Sounds like menopause. I'm sorry, I joke, but I know that's very serious. And she wrote, I'm exhausted, and I'm sure that you are. So hugs to you.
Absolutely. And, you know, I think the biggest lesson here is don't just think of it as emotional control. It's not. It may be emotional control, but let's first find out why he's having these bouts of up and down emotions. Let's find out what it is that transforms him or changes him to have these negative experiences or behaviors. So that, I think, is the key. You need to start writing down every time he kind of has a bout of negative behavior or challenging behavior. just go into a journal and write, describe the behavior that he's showing, and then write a little sentence or paragraph about what just happened, and then also how you intervened. Do that for like the next 3 days, and then sit down and read those, and everything that happened right before the behavior is the antecedent, maybe triggering it. You'll find some commonality perhaps that'll show, oh, he does this type of behavior whenever something, I don't know, a transition is occurring. It's a specific time of day where we move from one activity to another. Someone's about to come over. I ask him to do something, whatever it is. And then when you look at the consequences of how you consequated it, you may come find some sort of theme where it shows, oh, you know what, every time he does this, I go over and I start calming him, or I start trying to give him attention, or I tell him not to do it. All that sort of stuff then gives you the answer of what kind of consequences maintaining that behavior. So first, let's find out why these emotional outbursts are occurring. That's extremely important, and then we can talk about how to intervene. So take data on it for the next week, and then please come back and let us know how he does, just what you found from writing it down.
Absolutely. Wonderful. I want to go to another question. Thank you, Shannon and Dr. Doreen. We love you guys. Love your show. I have a 10-and-a-half. We love you too, by the way. I have a 10-and-a-half-year-old with ASD and verbal. He is frustrated. He has major aggressive behaviors, including self-injurious, pounding his head, hitting his head on the wall and doors, destroying property at times, and pushes me. Routine changes, transitions, anxiety, and mood swings is what I believe causes them. I feel like I'm moving backwards since he acts and behaves as he was 5 or 6 years old as he grows. He is in therapy, support group, and meds for attention and impulsive behaviors. He's on an inclusion program at school and has goals for attention and focus. Now his psych wants to add SSRI like Zoloft, since others like Abilify, 10X, etc. had failed, but I want him off of all of his daytime meds, and she puts in quote in parentheses Ritalin, since it's not working anyway, especially if that's the route she wants. But if she is hesitating on removing the meds, she is hesitating on removing the meds. Thank you. You help me to read always.
No worries.
Am I
wrong?
Am I wrong to want him off his meds and have the school instead to follow through with his goals?
Right.
And please, some advice and thank you.
Yeah, this is very important, and I don't want to say that you're wrong to want him off all the meds, but I think you should probably allow the doctors to help. The best intervention, in my opinion, is a combination of behavioral and medical. Medical often helps with various things, and we shouldn't. I think I'm one of those people that believes that the use of certain medications just is an advancement in science, and there is no real reason for us to be against all meds. To me, doesn't make sense, because we've already discovered that some of these medications are very effective. In my perception, so there's two things. First of all, please make sure that you don't classify all of his meds under one group. For instance, Ritalin is a stimulant, it's an amphetamine. It's very different from Zoloft, which is a serotonin reuptake inhibitor. Completely different mechanism, completely different use. All of these meds that you list, you need to kind of get clear on what the medication is for and why he's being given. If he's on Ritalin, then someone has diagnosed him with ADHD, clearly. The SSRIs are generally affecting things like anxiety and depression. So let's have a deep conversation with a psychiatrist and have some plan of action for what we're trying to achieve here. Now, in terms of behavior, you've done a pretty good job at identifying behaviors, aggressive behaviors, which are self-injurious, including pounding his head, hitting his head on the wall and doors, and then aggressive behaviors like destroying property and then pushing me. Those are some of the behaviors. And then you list some of the causes, like changes in routine, transitions, and then what you feel is anxiety or mood swings. What you need to do is tie these together a little bit better. So for instance, when he has self-injurious behavior, do the same thing I just suggested to the other parent. Take a diary and list when these behaviors occur. Now, when it occurs, list it exactly. So you can say it's self-injurious, but list exactly what he's doing. He's pounding his head against the wall or whatever it is. And then list exactly what happened before it, and then also how you dealt with it. That's the data that you need for a few days in order to be able to pattern this. Don't feel like you've regressed. You haven't regressed. The same things happen in society no matter what age we are. We have the same feelings, they just come up. So for a 5-year-old, it might be very frustrating if they can't get attention from their friends. For a 15-year-old, or yours is 10 and a half now, some other thing might be frustrating. The issue that these things are coming back is the same issue back then, which is there's a certain level of frustration and the child doesn't know a better way to express the frustration, so he does it this way. What could be causing the frustration? Yeah, it could be a variety of things, and some of them we can change behaviorally. For instance, transitions. Let's say if it's transitions, we can certainly help him with transitions. We'll give him techniques to be able to know a transition is coming. Often it's not transitions, it's transitioning from a preferred activity to a non-preferred activity. That's a different thing than just having problems with transitions. So again, we need to find out. And other things, for instance, mood swings or anxiety, we will get some help from the medications that he's on. Having said that, if it's not a child with ADHD and he is given ADHD medications, those will cause some anxiety in him. So it's important to clean up both sides, both the medical side and let's figure out the functions so we can do a nice functional type of treatment for him behaviorally.
Wonderful.